And I don't know about you, but when I was on my Easter break, it finally felt like life was back to normal, properly back to normal. Is the COVID pandemic finally over, do you think?
Yes, in this country. COVID's obviously endemic, meaning that it's everywhere and lots of people catch it. But, you know, every week they publish the statistics of how many people have got antibodies to protect you from COVID, and it's now over 99%. And that's great, and it means that we can have what is essentially a free existence here. But it's not over everywhere around the world. In fact, I think, you know, one of the really shocking things is watching how some of the countries that went for a zero COVID strategy at the start are now in real trouble negotiating their way to being, you know, part of the international community again.
The reason I'm asking you is because for the NHS, the sort of fallout, as you were saying, is still quite extreme for the NHS. I had a look at the stats before we sat down on April the 11th. There were 301 deaths and 40,000 cases. People on waiting lists for treatment, record levels of 6.2 million. A&E waiting times worst since records began. Trolley waits at record levels. I mean, I bet you're glad that this isn't your job to fix this anymore, huh? And crucially, the number of vacant hospital beds in England's lower than at any time since the start of the crisis. And you know that's a key measure of resilience.
Yeah.
I mean, if you had a close family member that needed NHS treatment against that backdrop, would you be worried about that?
Well, I think that fixing this is clearly critical, and there's a plan in place. The government put a plan in place to tackle this backlog. But, you know, a year ago, thinking about how to tackle the backlog post the pandemic was a priority. And then we had Omicron over last Christmas. And so it's obviously really serious, and it will take time to get through that backlog of you know, things that were postponed. So, you know, that's why I say the pandemic's over, but we're still with the hangover and the impact on the NHS. And remember, the people who work in the NHS are tired as well.
They must be so tired.
So there's a big, you know, it's a big challenge.
They're probably so tired that when you say as a former health secretary it's over, they might even feel a bit irritated by that, because they might be thinking, it's really not over for us. We're dealing with this still day in, day out.
Well, the consequences are still there, absolutely. But that's the difference between a disease being, you know, pandemic, affecting everybody in our normal lives, and endemic as a bad disease, you know, another flu.
Let's look back briefly on the You've talked about this loads. There's an inquiry. You've given evidence to select committees. I don't want to go on and on about it, but you are here, and you did live through it, and you did do a lot of decision-making around it.
Yeah.
On the positive, the vaccine task force has been widely praised, led by Kate Bingham. You, actually, by the Select Committee, were praised for personally taking charge of the testing system, although they were critical of test and trace.
Sure.
There's a couple of the successes. What do you think were the biggest mistakes? When you reflect back on it, what do you think, I wish I had done that differently?
Well, I think there's quite a lot of things that we need to learn from, both from the good and the bad. So it's really important to learn from the things that went well as well. It's a bit like after a football match, you know, the team that wins, you win 2-1 and everyone says, wow, that was an amazing performance, everything went right. Well, yeah, except that
you let a goal
in. So let's learn from the successes as well. We can learn from the vaccination programme, getting external expertise in, including from business, from academia and clinicians. That team, absolutely brilliant. Also completely giving them their head and saying, we want you to buy from around the world. We want you to, and basically, you know, the price is less important because the saving to the economy of getting this right is so big. So there were a couple of big learning points from the successes, and then, but there were areas that were problematic.
What's your biggest regret?
Well, one of the things I'd point to is some of the rules that were put in place, the way that they were interpreted on the ground. And that...
The restrictions, you mean?
Yeah, so, for instance, do you remember early in 2020, during the first lockdown, there were funerals that took place without their loved ones.
Yes,
you know,
you regret that.
I do, because it
So that was a
incredibly
mistake.
upsetting. And that was because of it wasn't the intention, but it was the consequence of the rules. And we saw that happen and we changed it. But nevertheless, you've got to be constantly...
Is that your biggest personal regret, do you think?
Well, that was one of them. But, you know, the thing is, managing something as big as a pandemic, you know, you're never going to get every decision right. Your aim is to get most decisions right, and especially when something is genuinely unprecedented. And
one thing I did want to ask you specifically on was the issue of care homes.
Yeah.
I know you've been asked a lot about it, but is that something now in retrospect you wish you had done differently,
well,
like discharging people into care homes without being tested?
No, I'm going to give you a different explanation of what happened. And I've obviously thought about this a lot.
Well, you've been asked to, I mean, and it will be a big focus of the inquiry,
It will.
I'm sure.
And so what the evidence shows is that the number of infections that got into care homes from people being discharged from hospital was very, very low. So there's been
I've got here an estimated 25,000 people were discharged from hospitals into care homes without getting a test.
Well, that's when...
At the height of the pandemic in the spring 2020.
Yeah, so that's when there weren't tests widely available, before we'd managed to scale up the testing.
Yeah.
That
must be a regret, though, mustn't it? Isn't it?
Well, if you let me explain what actually happened rather than what is the narrative around this, because this is somewhere where the narrative is wrong, and it's really important we correct it and learn the right lessons, not the wrong ones. So around 2% of infections got into care homes through that discharge process. And part of the reason is that because there wasn't a test, everyone was put into isolation. So I can't, you know, if you can come up with a better option of what to do with people who need to leave hospital and go back to their care home, you know, putting everyone in isolation, that was the policy. Now, the level of isolation will have been different in different care homes. The challenge, in terms of where the infection came from, is that everybody in the community, or lots of people were catching COVID, and inevitably people worked in care homes. But I didn't want to go and stand on that podium and effectively say that I'm terribly sorry this came from the staff who live in the community not knowing...
But it probably came from a mix, didn't it?
Well, so they've done the analysis and found actually the big change that we made that really affected this and meant that the likelihood of catching COVID in a care home was so much lower in the second wave was that we stopped people staff moving
between homes.
And that actually was a much, much bigger impact. So this comes back to the lessons piece. Yes, of course, one of the lessons is, you know...
Don't discharge people who haven't been tested.
Do you know what? I'm going to answer the question and then you can ask your next one, rather than you finishing my sentence.
I thought we were having a conversation, but OK.
Well, I'd love to have a conversation, but the conversation involves listening to the answer to my question, your question, right? So the point is this, right, that the policy of discharge involved everybody going into isolation because we didn't know whether they had COVID or not. The big impact that really protected care homes was when we said you can't work in more than one care home.
Yeah.
So one of the lessons we need to learn is you put that policy in place, right?
Yes.
And then the other, in terms of discharges, is you must have a testing system ready to go, because we had to build that from scratch. So those are the two lessons.
So that's fine, but so you do agree that that was a mistake to allow people to be discharged from hospital without being tested?
No, because
you're saying it's both things.
No, I'm saying it's that we didn't have the tests in place. So the lesson on that front is have the tests. Be ready with a testing system ready to go. And the reason I'm sort of really clear on this point and emphatic about it is that leaving people in hospital longer than they need to be in hospital is also bad for them and bad for the people who otherwise need to be in hospital. So the discharge policy had an important merit behind it.
Yeah. Okay.
So what I really think on care homes, and what I hope is coming over, is that there is a narrative about what went wrong in care homes. Fundamentally, the narrative is wrong. And part of the job of the inquiry and part of the lessons learning exercise is to learn the right lessons including from things that didn't go as well as they could have done.
Yeah, but that was the narrative we heard from a lot of care home bosses, wasn't it? That people were being discharged and bringing COVID
This is the
into
point.
care
This is why we're having
homes.
the discussion, because it's actually important to listen to the science and look at the evidence and learn the lessons from the science and the evidence, not say, well, because that was on the front page of the newspapers at the time, it must have been true, because that isn't actually what happened. The main thing that happened is that infections got in from the community.
We could spend a lot of time talking about this, because Dominic Cummings said that you told the PM anyone going into a care home would be tested. Even if you disputed that, you did tell the public there was a protective ring, and then people found that people were going that hadn't been tested. I take your point about staff as well.
OK, we can go through each of them.
I'm just saying, is it a regret? Or you seem to be saying that...
I'm saying that I think
it's not.
Well, no, I'm not. I'm saying no. So the point about Dom Cummings is, he's wrong. So that's not important. What is important is that we know as a society, next time there's a pandemic, because there will be one, we know how best to protect people in care homes. And if we learn the wrong lessons, then we will not do it next time as well as possible. And the thing I really care about is that the person in my shoes next time has like a manual on the
has a testing regime. So
but also more broadly than that, has a manual on the shelf that says, this is how you do it, because we didn't have that at all.
Yeah.
Except in some specific areas.
All of which will come out in the inquiry, which I think will be useful for everyone to get the facts out there.
Yeah.
Let's move on, though, because I would like to talk to you more about that, but I'm going to run out of time.
Okay.
So I want to talk to you about COVID casting a long shadow in other ways.
Yeah.
And specifically at the moment on the career of a Prime Minister who's now been fined by the police for attending a COVID event, an event that was deemed as breaching the rules. And he could receive more penalties. As you know, he's under investigation for other events, and there's been a number of fines for people within Downing Street and government. But you don't believe the PM should resign over this. Why not?
Because I think that when you're looking at who should be the Prime Minister, you've got to look in the round. You've got to look at the big picture. On COVID, I think that we got the big calls right. And there's a war. And the Prime Minister is leading the international response to Vladimir Putin. And so you've got to look forward and you've got to take everything into account.
Does your position stay the same however many fines he gets, or however much the public and the polling reflects an anger amongst the public? Does it change your view?
Of course I understand that anger, and the Prime Minister's apologised. And you've got to look at where we are now and what's happening now in the world. And, we're in this phase of history where, big things keep coming along. We just sorted Brexit when the pandemic hit, and then we were just coming out of the pandemic when the war started, and we've got to make sure, what is in the national interest? And that is what matters right now.
And you are speaking as a politician and a loyal lieutenant to the Prime Minister, but it must resonate with you on a personal level too, because you did resign. You had a relationship with someone. It became public in a way that was obviously difficult for you and your families. Yeah. You were found to have broken guidelines. You resigned. Do you feel bitter looking back about being exposed in that way and forced to resign, and you don't feel that there's a contradiction in the Prime Minister's behaviour? How do you feel about it on a personal level now? No,
I wasn't forced by anybody to resign. I chose to resign. And in a way, it makes the point more powerfully that in the Prime Minister, you have to look at who is best placed right now to be leading this country with the challenges that we face. And especially, the response to Vladimir Putin is the single most important international thing going on right now, and responding to the cost of living crisis domestically. And on the former...
people would also say that prime ministers have been changed at times during war, and we aren't actually directly at war in the UK.
But the
I
Prime
know
Minister...
this is a much rolled out
It's
reason,
much bigger than that,
but
right?
some of your colleagues would disagree with that.
Well, people disagree in politics. That's the nature
well,
of the thing, isn't
I'm
it?
just saying that
you know, that's
there's
in
a
fact,
counter-
I'd argue that in a democracy, the disagreement is the point. And some of our opponents strategically, who think that you should have an autocracy and not have disagreement, don't get the point that this cacophony of debate isn't a weakness; it's a strength. It's the point of politics. So of course people disagree with me, but
that's how you feel.
But how I feel about it is you've got to look. What is in the national interest is, you know, essentially Vladimir Zelensky's closest international ally, the guy who has played an absolutely leading role in ensuring the strategic response to Putin is not to split the West, which is what Putin wanted and I think expected, but to unite the West and most of the rest of the world in response.
Can I come back to your situation, because you had these photos leaked of you and Gina, who you're now in a relationship with, and the Information Commissioner's office has said there's not enough evidence to prosecute the people suspected of leaking that footage. I mean, it was in your private office. I mean, this was security. How do you feel about that? Do you just want it... Wow. Is it just done now?
I've said everything I'm ever going to say on that subject. So,
do you want them to be prosecuted? Do you just...
I'm just absolutely not going there.
You're not going to go there, OK. And Matt Hancock, to finish off, you came into Parliament in 2010. You became a minister, I remember it, in 2012. You were in the Cabinet by 2018, and then you had this massive bump in the road for your career that wasn't just political but also personal. Did you sort of think about just packing it in and doing something else and beginning a new life in a different career, rather like your mentor, George Osborne, did after 2015? Did you give that some thought?
Well, obviously, when something huge happens like that, you think about, everything across the board. But the other thing is, I've got a job to do representing my constituents, and I love doing that. And I've been able to spend far more time on it in the last year than I did before. And also, being in Parliament is a real privilege. You have a platform to talk about and make changes on areas you really care about. So take the campaign that I'm running on dyslexia. I'm dyslexic.
And didn't find out until you were at university.
Exactly.
I don't know how you got to Oxford...
Based on maths, basically.
But you basically got to Oxford University not knowing that you were dyslexic.
Yeah, but thankfully I'm very good at maths, so I appreciate how I'm one of the lucky ones who got through. But still, 1 in 5 dyslexic kids, only 1 in 5, get identified at school, and we've got to change that. And the department have now made some changes and put out a green paper about this. And so, that is, making change from the backbenches on a subject I really care about, personally affects me, and I wasn't able to do because I was in different ministerial roles in government. And so, I love doing that. Other former cabinet ministers said to me after I resigned, they said, the problem is going to be, you're going from your time being programmed out to every 5 minutes. Sometimes my loo breaks were programmed into the diary.
Were your loo breaks actually written in? No, really. I actually want to know this.
Not every day, but on busy days.
Was it literally written in?
On busy days, yeah.
The Secretary of State can go for a comfort break.
Yeah. And
5 minutes.
And then back at your desk. And then going to having a lot more freedom in how you use your time. I've really enjoyed that, and I've been able to choose how I spend my time.
One more thing, you talked a lot about the Prime Minister and Ukraine. Number one, you think he'll be the Prime Minister by the end of the year still? You don't think...
Oh, yes. I think he'll lead
You
us.
don't think there will be a confidence vote? You don't think your colleagues might try and unseat him?
That's right.
You don't think that will happen?
I do not think that will happen.
Well, Matt Hancock, thank you for coming on, and I imagine I will see you back in Cabinet, certainly before you hit 50. What do you think?
I'm just enjoying life on the backbenches.
All right, thank you very much.